Hi, my name's Evan, and this is the Sinus trigger. So I just got an order on the computer for a Sinus series, and I checked the requisition, and it matches with the order, and I am now going to go and set up the room. I have my 8x10 film. I'm going to put it in the Bucky Fortress. And we'll now detent the tube. Have it all ready, and we'll now go and get my patient. Oh, hi there, Priscilla?
Yes.
Hi, my name's Evan. I'll be doing your x-rays today.
Perfect.
Can you verify your date of birth for me?
August 1st, 1989.
Perfect. Alright, you want to come with me?
Sure.
And what's your reason for having this x-ray?
I've had this chronic sinus infection for like 2 months, and it can't go away.
Okay. And is there any chance you could be pregnant?
No.
No? Alright. Now I'm going to have you remove all your jewelry around your head and follow me. Alright, I will now be performing the PA axial cogwheel with the head tilt to 15 degrees. We'll be using the 8x10 film, and I will be using the Bucky. I will be using the sponge to help with the head tilt. I already have my tube set at 40 inches with a perpendicular angle to the IR. I will now shield my patient. Come on over here. And I made sure the patient took out any hardware, earrings or necklace or anything they have on. Oh, there we go. There we go. Alright, go ahead and put your chest up against this here. We'll put the sponge on your forehead and put your nose against the board. Alright, with the sponge it creates the OML at a 15-degree angle to the IR. And I have my beam perpendicular, and I have the exiting ray weaving right at the nasion, and I do have a cone on the tube, but we do not have any here, so we will imagine that is on there. And I will put my right marker on the right side of the patient, and the technique I'll be using for this is 75 at 20 mass. And I will now go and take the image. I will now be doing the parietal canthal waters view with an 8x10 film. And I have my patient come up to the board, and I'm going to have them tilt their head chin up, and I'm having the OML create a 37-degree angle to the IR. I have my tube at 40 inches, perpendicular to the IR. I have my patient shielded. I will now place my marker on the left side of the patient. Come down here. And I would have a cone on this, but we do not have one here, so we'll pretend it's there. And the technique I'll be using will be 75 at 20 mass for this. And I will now take the image. I will now be doing the lateral sinus. And I'll be using, once again, 8x10 film. I have my tube at 40 inches. I'll have my patient come up and get in the RAO position with the cheek against the board and facing me this way. So I will have the mid-sagittal plane parallel with the film and the interpupillary line perpendicular with the film this way. I have my tube lined up. I will have it at central ray at 1/2 inch posterior to the outer canthus, and I have the patient shielded. And the technique I will use for this will be 75 at 20. I will now take the image. I will now be performing the SMV view for the sinuses. I have the patient seated in front of the IR. I've switched the shield around so it's not covering the front. I will have her tilt her head back so that her IOML will be parallel with the IR. I have my tube at 40 inches with a cone on it coming in perpendicularly to the IR and entering 3/4 inch anterior to the EAM. So, could you now put your head back for me all the way and touch the film? A little bit up, just like that. Perfect. Alright. There's my central ray. Cone down here. Alright. I'm going to put my marker on there. And the technique I will use will be 75 at 20 mass. I'll now take the image. Here is the PA axial Caldwell method for the sinuses. The criteria for this is evidence of proper collimation, equal distance between the lateral border of the skull and the lateral border of the orbits, looking for no rotation. You want the petrous ridges symmetrical on both sides. You want the petrous ridge lying in the lower third of the orbit. You want the frontal sinus lying above the frontal nasal suture and the anterior ethmoid air cells lying above the petrous ridges. You want the frontal and anterior ethmoid air cells. And you want clearly visible air fluid levels if present. Here is the parietal acanthial Waters method for the sinuses. The structures you're looking for is the frontal sinus, the ethmoidal sinus, infraorbital foramen, maxillary sinus, petrous ridge, and the mastoid air cells. And the criteria for this image is to have the petrous pyramids lying immediately inferior to the floor of the maxillary sinuses, equal distance between the lateral border of the skull and the lateral border of the orbit on both sides, showing no rotation, the orbits and maxillary sinuses symmetrical on each side, and you are looking for air fluid levels if present. Here is the lateral projection for the sinuses. The structures you are looking for is the frontal sinus, sella turcica, sphenoidal sinus, ethmoidal sinus, maxillary sinus. And the criteria for this are all four sinus groups, but the sphenoidal sinus are the main importances. You want no rotation of the sella turcica, superimposed orbital roofs, superimposed mandibular rami, and you're looking for air fluid levels if present. Here is the SMV projection for the sinuses. The structures you're looking for are the maxillary sinus, ethmoidal sinus, the mandible, the vomer, the sphenoidal sinus, the pharynx, and the petrosa. The criteria for this is equal distance from the lateral border of the skull to the mandibular condyles on both sides, indicating that the mid-sagittal plane is perpendicular. You want the anterior frontal bone superimposed by the mental protuberance, indicating that the IOML is parallel to the IR. You want the mandibular condyles anterior to the petrous pyramids, and you are looking for air fluid levels.